And still on the topic of healthcare, authorities are increasingly turning to family doctors to support various types of outpatient care for the elderly, infirm and those suffering from chronic diseases.
But again, there's also a shortage in this field, which is a growing concern not just here but in an aging Asia.
Now, here to tell us more about this need is Professor Lee Kheng Hock. He's president of the College of Family Physicians in Singapore. Thank you for joining us, Professor.
Thank you for having me here.
Well, we just mentioned the demand for healthcare there, has been rising. There's been a crunch for hospital beds and also for the staff to kind of help out. How can family doctors play a role in helping ease this area? Okay,
so many people think that this is a Singaporean problem, but actually it's a global problem. If you read the headlines from cities to Toronto, to Hong Kong, to Kuala Lumpur, to Melbourne, you will find that there are reports of bed crunch, long queues at the emergency rooms, to the point that the Director General of the World Health Organization actually said that this is a global phenomenon. Due to the rise of chronic diseases, aging population, increasing demand for healthcare resources, and she actually said that primary care is the backbone and family medicine is the bedrock, and this is the solution for this problem of this increasing demand that's very hard to be met.
So when you say this is the solution, you mean family physicians, family doctors stepping in to help ease, to come in between, is that right?
Yes. So as we build more beds, we also need to bring the care into the community. So for example, acute hospital stay on average is about 6 days. So now acute hospitals are for life-threatening conditions. So after the 6 days of stay, there's another 350 days. So who is going to take care of the patient? So the real care of the patient actually should happen in the community. And everyone is realizing that you really got to gear up family medicine. You got to give them the resources, empower them with the knowledge and competency to help patients in the community. So there's this shift.
Professor Lee, when you say family medicine, do you mean the knowledge that the family has in taking care of the elderly who are staying at home?
Right. No. Family medicine, you people used to equate in the old days to GPs or polyclinic doctors, but it's actually a field of science of medicine in itself. So it specializes in taking care of patients, providing continuity of care. So in the old days, if you finish your medical degree, and effectively you practice the so-called family medicine. But because of the complexity of healthcare and the needs of complex diseases and so on, they realized that a doctor needs additional training to be able to do this role. So to be a family doctor, if you go through the specialized training to become a family doctor, it takes about 5 years. And that's about the same as if you should take up a specialty in ophthalmology or any other specialty.
So they're specializing in family medicine, and I guess what they're doing is taking a more holistic view of the patient. I guess because we always think of seeing the doctor, general practitioner for just a cough and cold, and not for anything more serious in that sense, right? But I guess now this will be our first stop where he can advise us what to do next. Is that where they come in?
Yes. So this is the model for family medicine back in the 70s, and it's beginning to change. Exactly because of the aging population, the rise of chronic diseases that are really complex, organ failures like renal failure, heart failure, and so on. So when they are in the acute stage, life-threatening stage, they go to the hospital. 6 days, they're out. Now, who's going to take care of them the rest of the 350 days? So you really need to gear up family medicine doctors to treat these kind of patients in the community. If they keep going to the hospitals, then no matter how many hospitals you build...
But the thing is, it's not just the doctors themselves, it means the patients as well. We need to understand that now my family physician can do more. And I need to accept that I trust him to sort of be able to take care of me in that holistic way.
Yes, so you're quite right. So this is an evolving model, and I think everyone is trying to gear up, at the same time bring up that information and the awareness to the public as well.
Professor Lee, what is your organization actually doing then, I mean, in terms of actually leading the way to meet this demand?
Okay, so my organization actually advocates for this kind of care. This kind of family medicine that can take care of this kind of patient, that meet the needs of the nation, and this change is coming up. So our college was formed in 1971. Way back, that's about 43 years ago. So we are already advocating for higher training to meet this anticipated problem. So what happens is that we have started training this so-called equivalent of specialist training in family medicine for the past, since 1972, we have been
So
starting this.
basically what you're saying is that what doctors need to realize is that this is something that they can be trained in to equip them with the right tools to be able to care for their patients in a more effective manner. Well, unfortunately, we have run out of time, but thank you so much, Professor Lee there, Professor Lee Kheng Hock, President of the College of Family Physicians Singapore, telling us the need for family doctors in Singapore and in Asia, and it seems all over the world, in fact.